speaker is Erin. Erin is an undergrad student who's been working with the Guelph Family Health Study, well, since the pandemic started, for sure. I've seen Erin's face once in person, but we're thrilled to have you and excited to have you present. And Erin's favorite snack is?
Apples and peanut butter. Personal favorite.
So Erin, whenever you're ready.
Perfect. Thank you both so much for that lovely introduction. As Jess mentioned, my name is Erin, and I'm a research assistant with the Guelph Family Health Study. I also conducted a fourth-year research project this past year. And through this project, I aim to answer the question, are children in the Guelph Family Health Study eating a healthy breakfast? To begin, breakfast is often referred to as the most important meal of the day, as this meal provides energy and nutrients that are needed for the day. Many previous studies have associated eating breakfast regularly with positive health outcomes such as improved body weight, as well as cognitive function. Previous studies have focused on the frequency of breakfast consumption and have found that only a small number of preschool-aged children skip breakfast regularly. The fact that almost all preschool-aged children eat breakfast justifies a focus on breakfast quality, which is what my project focused on. Focusing on breakfast quality can help to identify gaps and areas in which the breakfast meal can be improved. In order to assess breakfast quality, benchmarks for a healthy breakfast are needed. This will allow us to compare the calorie and nutrient intakes of the children in the GFHS at breakfast to the recommended benchmarks. The International Breakfast Research Initiative, or the IRBI, established these benchmarks for a healthy, balanced breakfast. These benchmarks represent a number of calories and amount of each nutrient that should be consumed at breakfast. And these benchmarks can be used to assess the breakfast quality of anyone aged 3 or older. All of the data for this project was collected through ASA 24, which likely sounds and looks pretty familiar to you, as you have all been amazing at completing your ASA 24 recalls. Thank you so much for doing this, as projects like mine would just not be possible without the time that you have put into completing yours and your child's ASA recalls. For this project, children in the Guelph Family Health Study aged 3 to 5 were included in the breakfast quality assessment. Only 3 out of 163 children did not report consuming breakfast on the day of recall. The breakfast quality of the remaining 160 children was assessed by tallying the number of children who met the IRBI recommendations for energy, or the amount of calories consumed at breakfast, and many nutrients. So now I will be presenting how many children in the GFHS met or did not meet the recommendations for a healthy, balanced breakfast for each nutrient. The green on each graph represents the number of children who did meet the recommendations, and the red represents the number of children that did not. So first, looking at energy, we can see that 83% of children met the recommendation, which demonstrates that children in the Guelph Family Health Study were eating enough food at breakfast on the day of recall. As you can see from the graph that represents added sugar, most children in the Guelph Family Health Study are eating a relatively low amount of added sugar at breakfast and do meet the recommendations. In terms of other nutrients, for example, protein, carbohydrates, fat, and dietary fiber, the majority of each graph is red, which shows that most children in the Guelph Family Health Study are not meeting the recommendations for these nutrients on the day of recall at breakfast. These nutrients represent areas of improvement for the breakfast meal. As you can see from this next slide, only a small number of children are meeting the recommendations for vitamin D, calcium, vitamin C, iron, and potassium at breakfast on the day of recall. The majority of children are not consuming enough of these nutrients at breakfast and do not meet the recommendations. Although the amount of red on these graphs may seem a bit alarming at first, it's important to consider that they only represent the amount of each nutrient consumed at breakfast and not for the entire day. So for example, only a small number of children met the recommendations for vitamin C at breakfast. However, it's very possible that children in the Guelph Family Health Study are consuming foods rich in vitamin C throughout the rest of the day and overall do meet the recommendations for the day, just not at breakfast. In addition, since we only assessed one breakfast meal for each child, the day of recall may not have been a typical day for their breakfast. So overall, we can see that the vast majority of children in the Guelph Family Health Study are consuming breakfast and consuming enough calories at breakfast. However, the nutritional quality of breakfast is sometimes poor and lacking in key nutrients such as calcium, vitamin D, and fiber. These results can be helpful for nutrition education and intervention programs that aim to improve the overall nutritional quality of breakfast. So now you're probably wondering, how can I ensure that my child is eating a healthy, nutritionally balanced breakfast? First, It is important to offer a variety of foods that align with Canada's food guide, including whole grains, protein foods, and fruit. Eating fruit at breakfast can improve fiber intake and boost intake of nutrients such as vitamin C and potassium. Dairy and fortified plant-based dairy alternatives are good sources of calcium, and eating eggs at breakfast can improve vitamin D intake as well as protein intake. Finally, consumption of whole grain breads and low sugar cereals can increase overall nutrient and fiber intake. Overall, breakfast is the most important meal of the day, and there are many ways to ensure that your child is starting their day with a healthy breakfast. Thank you for listening.
Awesome. Thanks so much, Erin.
I'll make sure tomorrow I eat a great breakfast. With lots of
Sounds good, Eleanor.
You've had one convert for sure. So thanks so much, Erin. That's a fabulous job. For those of you that have not found your way to our Healthy Habits, Happy Homes podcast, Sabrina and Lisa are our co-hosts, and they just wrapped up season 3. And the last episode of season 3 has different members of our team talking a bit about who they are and introducing themselves. And one of the questions many of them asked was their favorite breakfast food. So if you're curious what Guelph Family Health Study people eat for breakfast, Healthy Habits, Happy Homes podcast on our website, season 3, the last episode. You can find that out.